Let's talk a little bit about trauma's impact on the brain and what happens in development. So the concept that I want to highlight is it's use-dependent development. So what exactly does that mean? Well, the brain is a use it or lose it organ, okay? I think one of the best examples of this is when you're learning a language. And they say you need to use it so that you can develop and continue to get it growing and expanding, right? Well, if you don't use that language over periods of years, time, whatever it is, well, you lose it, right? So think of it in that same way. And the neural system in our brain, once it's activated, it continues to respond and adapt and extend. Okay, I love to say repetition breeds permanence. Whatever we repeat becomes permanent. Well, think about now trauma's on the scene, especially in development, right? And because of that, when trauma comes on scene, what are we repeating? Well, we're actually repeating limbic activation. So we're repeating sympathetic nervous system response. We're repeating a stress response, and might even be going to the part of repeating that the world is a threat and you should maintain that hypervigilance. You should maintain that sense of fear in the environment. And so because of that, we really have to be mindful of how our treatment approaches look, how we are responding to someone who has a traumatized brain, because they've had periods of time where that use-dependent development has been activated. Okay, so this instant trust that we may have with someone who has not developed trauma or had experienced trauma before, it's not going to be the same, right? So I want you to think about how this plays out when we think about treatment. The other piece that I want to really highlight here is some of men's work that came out of 2025, looking at that when there is consistent repetitive use of the limbic system, that the blood then in the brain starts to adapt to going where it's needed the most. Okay, what do I mean by that? If I'm always activating the limbic system in a stress response or in a fear-based pattern because of trauma, what ends up happening is blood-based patterns develop in the brain that it starts to limit the amount of blood flow going to the cortex. So there's that problem solving, creativity, that spontaneity, that executive functioning, self-awareness, spirituality, all those great things that we want, especially in treatment. But it starts to decrease blood flow there and increase blood flow to the limbic system. Why? Because it recognizes the patterned, repetitive behavior that it keeps getting turned on. Think of it more as like energy in a house. If we know that there's only so much energy in this house, but we use our office the most, and what if the house responded to that and limited power to the rest of the house to make sure that the office gets used a lot? Well, same pattern is happening in the brain. So actually, what happens over time is blood-based patterns get instilled into the brain, meaning we have to be incredibly intentional at breaking some of these biological patterns that develop in response to trauma that happens. So if you don't walk away with anything that I'm saying right now, the thing that I want you to walk away with is the concept that repetition breeds permanence in the brain, okay? It is a use-dependent development. And that can be really helpful when we think about length of time in treatment and the type of treatment that we have access to.